Good day, everyone. I'm Charisse Pabayo, Master of Science in Hospitality Management at Lord's College, Cagayan de Oro City. My study is entitled Attitude Towards Travel Risk, Subjective Norms, and Perceived Behavioral Control as Determinants of Tourist Travel Intentions Amidst the Pandemic. So here's the rationale of my study. The COVID-19 disruption significantly affects the travel industry. As a result, having a thorough understanding of travel intentions is critical for hospitality and tourism businesses to respond effectively to catastrophic phenomena. The impact of COVID-19 pandemic on tourism industry, such as the travel restrictions, quarantine measures, and fear of infection affecting the travel behavior of tourists. That's the reason why understanding these factors are crucial for the recovery and sustainability of the tourism industry. This study also helps in the decision-making process required to revive the tourism demands for marketing and planning. This study also assists. It may assist the product development and also improving the safety and security of the tourist. So this is the study's framework, which is anchored on the theory of planned behavior that was developed by Isaac Eisen. We have attitude towards travel risk, subjective norms, perceived behavioral control, and intention to travel. Overall, this study aims to investigate the influence of attitude towards travel risk, subjective norms, and perceived behavioral control on tourist travel intentions during the pandemic. The findings of this study can help the tourism industry stakeholders to better understand tourist behavior and develop appropriate strategies to promote tourism during and after the pandemic. For the study's methods, the study utilized a quantitative descriptive correlational research design. The questionnaire was modified based on the theory of planned behavior questionnaire construction of Eisen in 2013 and a recent study questionnaire by Liu and others in 2021 that was actually used as a guide on constructing the research instrument. The questionnaire goes through validity and reliability tests using Cronbach alpha coefficient. A total of 200 tourists who check in the different Department of Tourism accredited hotels and resorts within Cagayan de Oro City. The tourists were selected using non-probability sampling, and then questionnaires were distributed with the consent of the managers and the human resource personnel. For the statistical treatment, statistics was used to assess the tourist's attitude towards travel risk, subjective norms, and perceived behavioral control. On the other hand, linear regression was used to determine if participants' attitude towards travel risk, subjective norms, and perceived behavioral control may predict. Now, results showed that tourist attitude towards travel risk is generally high. It means that tourists may still take appropriate safety precautions and plan their trips carefully to minimize potential dangers. Specifically, tourists have a very high preference to travel to areas where hotels are COVID certified with clean and safe practices as long as the area is following the minimum health safety standards. Results also reveal that tourists' subjective norms of traveling is moderately high, wherein tourists are somehow affected whether the significant people in their lives, such as their families and their friends, support or oppose their travel amidst the pandemic. Additionally, results indicate that tourist has a high level of perceived behavioral control, which indicates that tourists feel confident in their ability to manage their behavior and achieve their desired outcomes while traveling. Surprisingly, tourists feel that there is something that prevents them from traveling and find it not easy to travel during a pandemic. Results also showed that the tourist level of travel intention is generally high. This signifies that they are expressing a strong desire or willingness to travel despite the potential risks and challenges posed by the pandemic. Overall, results reveal that the whole model is significant. Thus, there is evidence showing that Tourists who have high perceived behavioral control and subjective norms may predict their intention to travel. Specifically, among the predictor variables, perceived behavioral control is the highest predictor, indicating that in every increase in their perceived behavioral control, there is a corresponding increase in their intention to travel. This is followed by subjective norms. These findings indicates that tourists' intention to travel is determined by their degree of control. It only means that the more tourists perceive that they can control a situation, the stronger their travel intention is. For the study's conclusions and recommendations, it can be inferred that tourists are inclined to travel amidst the COVID-19 pandemic. These inclinations are significantly triggered by their positive perception and confidence in their capabilities to control the situation, regardless of the position may be. Remarkably, this study discovered that subjective norms and perceived behavioral control are the strongest predictors of travel intentions when compared to attitude towards travel risk. Tourists tend to take risks even in a pandemic period as long as they are aware that their destination is safe and is following the minimum public safety health standards. This study provided evidence for the applicability of the theory of planned behavior by Isaac, which can be used to examine travel intention in significant public health crises such as the COVID-19 pandemic. Now, based on the findings and conclusions, the following are the recommendations. To the local government unit, they may utilize various approaches to give enough information to meet the tourist's desire to safety. Regardless that the vaccines are already available, they can continue to inform the public about non-pharmaceutical measures such as social distancing, hygiene, and face mask use, which can help reduce the spread of viral diseases. To the hotels and resorts management, they may consider applying for a safe travel stamp to be globally recognized as a fun and safe travel facility and destination. They may also require employees and guests to be fully vaccinated. They may utilize social media platforms to increase awareness to the public and make online short video marketing about what the company is doing to ensure that safety and health standards are strictly met. Next would be for the Department of Tourism. They may require all DOT accredited accommodation, establishment, and tourism destination to apply for a safe travel stamp. For the airlines and the transportation sector, they might consider providing convenient hygiene and information kiosks within their facilities to encourage employees, passengers, or tourists to practice self-protective health behavior. This kiosk, for example, can provide several hand cleansing tools and multilingual displays of current health concerns at frequent places in airport boarding lounges. For the tourism and hospitality enterprises, they may consider to apply for a safety and hygiene stamp or the safe travel stamp for travelers to recognize that the business have adopted global health standards protocols. They might also implement limited carrying capacity with the maximum number of tourists a place can accommodate without negatively impacting the environment, at the same time reducing the chance of tourists getting infected by the virus. And then for the future researchers, they may consider other variables in travel intention, such as risk perception, self-efficacy, desire, and curiosity, as pandemic alerts changes over time, and it might investigate local and international differences. So these are my references. Now, the impact or outcomes of the study helps the policymakers and tourism stakeholders to better understand the factors that influence tourist travel intentions during a pandemic. It can guide the development of effective policies and strategies to boost the tourism industry's recovery, provide insights into the factors that affect tourist behavior, which could help tourism businesses to adjust their marketing strategies to address customers' concerns and reduce risk perceptions. This would also contribute to the academic literature on the factors that influence travel intentions during a pandemic, and overall, the study's outcomes could provide valuable insights into the factors that influence tourist travel intentions during a pandemic, which could help policymakers, tourism stakeholders, and businesses to develop effective policies, strategies, and marketing campaigns to support the tourism industry's recovery. Thank you all for listening, and God bless us all.